Gynecomastia Overview. We rise by lifting others. Robert Ingersoll. Gynecomastia is an increase in the amount of breast gland tissue in boys or men, caused by an imbalance of the hormones estrogen and testosterone. Gynecomastia can affect both one or both breasts, sometimes unevenly. If you have enlarged breasts because of fat deposits, you have a different condition called pseudogynecomastia. Signs and symptoms of gynecomastia include swollen breast tissue, breast tenderness. Gynecomastia in infants or neonatal gynecomastia. More than half of male infants are born with enlarged breast tissue to the effects of their mother's estrogen or placental estrogen. Generally, the swollen breast tissue goes away within 2 to 3 weeks after birth. Gynecomastia during puberty. Gynecomastia caused by hormone changes during puberty is relatively common. This is due to excess estradiol. In most cases, the swollen breast tissue will go away without treatment within 6 months to 2 years. Gynecomastia in adults, senescence gynecomastia. The prevalence of gynecomastia peaks again between the ages of 50 and 69. At least 1 in 4 men in this age group is affected. There is a decreased circulating testosterone causes hyperestrogenism. Gynecomastia usually doesn't predispose the male breast to cancer. However, hypoandrogenic state of Klinefelter syndrome with gynecomastia predispose the breast to cancer. Classification of gynecomastia according to grade. Grade 1, mild breast enlargement without skin redundancy. Grade 2A, a moderate breast enlargement without skin redundancy. Grade 2B, moderate breast enlargement with skin redundancy. Grade 3, marked breast enlargement with breast enlargement and ptosis. Pathologic mechanism that may cause gynecomastia. Estrogen excess state, androgen deficiency state, pharmacologic causes, idiopathic causes. Estrogen excesses, testicle or non-testicular tumors, nutritional alterations such as protein and fat deprivation, endocrine disorders like hyperthyroidism and hypothyroidism, hepatic diseases like alcoholic and non-alcoholic cirrhosis. Repeating gynecomastia related to resumption of pituitary secretion after pituitary shutdown. Androgen deficiency, elevated level of testosterone binding globulin with decreased circulating testosterone level. Senescent gynecomastia, common in 50 to 70 years old. Hypoandrogenic state can be from primary or secondary testicular failure. Klinefelter syndrome, example of primary testicular failure. Trauma, orchitis, and cryptorchidism may initiate secondary testicular failure. Renal failure may initiate gynecomastia. A number of medications can cause gynecomastia. These include anti-androgens used to treat an enlarged prostate, prostate cancer, and other conditions. Examples include flutamide, finasteride, like Posca, and spironolactone, aldactone, carosphere. Anabolic steroids and androgens, which are prescribed by doctors for certain conditions, are sometimes used illegally by athletes to build muscle and enhance performance. AIDS medications, gynecomastia, can develop in men who are HIV positive and receiving a treatment regimen called highly active antiretroviral therapy. Efavirenz is more commonly associated with gynecomastia than are other HIV medications. Cancer treatment, heart medications such as digoxin and calcium channel blockers, stomach emptying medications such as metoclopramide, drugs with estrogen activity like digitalis, estrogens, anabolic steroids, marijuana, drugs that enhance estrogen activity like human chorionic gonadotropins, drugs that inhibit action of synthesis of testosterone like ketoconazole, phenytoin, spironolactone, anti-neoplastic agents, diazepam. Drugs with idiopathic mechanisms like reserpine, theophylline, verapamil, tricyclic antidepressants, and furosemide. Substances that cause gynecomastia include alcohol, amphetamines used to treat attention deficit hyperactivity disorder, marijuana, heroin, methadone. Several health conditions can cause gynecomastia by affecting the normal balance of hormones. These include hypogonadism, conditions that interfere with normal testosterone production, such as Klinefelter syndrome or pituitary insufficiency, can be associated with gynecomastia. Aging. Hormone changes that occur with normal aging can cause gynecomastia, especially in men who are overweight. Tumors. Some tumors, such as those involving the testes, adrenal glands, or pituitary glands, can produce hormones that alter the male-female hormone balance. Hyperthyroidism. In this condition, the thyroid gland produces too much of the hormone thyroxine. Kidney failure. About half the people being treated with dialysis experience gynecomastia due to hormonal changes. Liver failure and cirrhosis. Changes in hormone levels related to liver problems and cirrhosis medication are associated with gynecomastia. Malnutrition and starvation. When your body is deprived of adequate nutrition, testosterone levels drop while estrogen levels remain the same, causing a hormonal imbalance. Gynecomastia can also happen when normal nutrition resumes. Herbal products. Plant oils such as tea tree or lavender used in shampoos, soap, or lotions have been associated with gynecomastia. This is probably due to their weak estrogenic activity. Risk factors for gynecomastia include adolescence, old age, use of anabolic steroids or androgens to enhance athletic performance, certain health conditions including liver and kidney disease, thyroid disease, hormonally active tumors, and Klinefelter syndrome. Complications. Gynecomastia has few physical complications, but it can cause psychological or emotional problems caused by appearance. Prevention. There are few factors you can control that may reduce the risk of gynecomastia. Don't use drugs. Example include steroids and androgens, amphetamines, heroin, and marijuana. Avoid alcohol. Don't drink alcohol. If you drink, do so in moderation. Review your medications. If you are taking medication known to cause gynecomastia, ask your doctor if there are other choices. Treatment. The cause or precipitating factor must be identified. Testosterone administration if androgen deficiency. Discontinue medication if it is the cause. Specific therapy to endocrine effects. Danazol treatment is successful in reversing gynecomastia, but the androgenic effects are considerable. Surgical therapy, it is considered if gynecomastia is progressive and not responding to treatment. Techniques, local excision, liposuction, and subcutaneous mastectomy. You really can change the world if you care enough. If you like to hear more updates, please subscribe to my channel and click the notification bell. Thank you.